The federal-state partnership is really important to increase the reach of HAI prevention beyond the federal agency. So CDC does multiple things in that regard. They provide funding to state health departments. So they provide funding for an HAI coordinator. And with the new antimicrobial resistance initiative, there will also be an antimicrobial resistance expert at each state health department. So that's one critically important thing. They also provide the National Healthcare Safety Network, the NHSN infrastructure, which has multiple users and uses. It's a standardized surveillance system with defined protocols and definitions, and it provides the infrastructure for reporting and analysis. So we at state health departments, we don't have to maintain our own servers or our software. We can utilize this infrastructure, and so that we can use the data for action. So that's really important for us. We're all about data for action. And then the next area where CDC really assists us is with technical expertise in both epidemiology and also laboratory capacity. So our state public health lab has gotten assistance from CDC on how to do resistance mechanism testing, for example, for carbapenem-resistant Enterobacteriaceae, or CRE. For example, in Tennessee, back in 2008 and 2009, we had a problem with central line-associated bloodstream infections in our intensive care units. We had a prevention collaborative. We fed the data back to our hospitals, and when they saw where they were, that engaged hospital leadership to take some actions and provide the appropriate resources. And so we've now seen a gratifying decrease in our central line associated bloodstream infections. Our problems now in Tennessee really are predominantly surround MRSA bloodstream infections. And also we still have this challenge with catheter associated urinary tract infections in our intensive care units. So we need to understand where we have a problems so that we can go and focus our efforts in where we can make the biggest difference.